So anyway, speaking of our guest, Dr. Scott Eisenberg, welcome.
Thank you
Again,
so much.
I understand he's been a regular here with us.
Yes.
I'm honored. It's my third time.
Very good. So you're just old hat, no stress, no nervousness.
That's true.
But you are a cardiologist at Jersey Shore Medical Center.
I am, as well as Center State Medical
Center
Center.
State also. And I know that there's been a lot going on this month because of it being Women's Heart Health Month. And I think I know you had said you had recently done a presentation. Maybe let's start with that and see how our conversation goes.
Sure. Well, first off, this month is Women's Heart Month, and I am fortunate enough to be honored as the current chairperson for the annual American Heart Association Heart Ball every year at May 31st. So if anyone out there is listening in terms of their donations, if they want to donate to the American Heart Association, that's all the proceeds go to earning money. We have goals, and I, as the chairperson, that's my goal, is to get the numbers up.
And where is this going to be held?
This is held usually in central North Jersey every year at a country club that they have, and it's a very big thing. Most of the Central Ocean and Monmouth counties, all the cardiologists and all of the corporations such as Meridian and St. Barnabas, and all of them participate in this. It's a very big affair. They honor usually a cardiologist of merit every year. But of course now it's so important because this is Women's Heart Month, and I was fortunate Center State Medical Center actually put on an entire Women's Heart Fair, and so I prepared. I was one of 4 cardiologists that prepared lectures to update women and heart disease. Mine happened to be hormones, heart, and anti-aging. So we can incorporate that in some of our discussion. But the premise, of course, is to know your risk. And sometimes that's very difficult, and also to know about symptoms. And the symptoms are the hardest part. Some years back, probably about 2002, there was she still is probably the most prominent female cardiologist in the United States, in the world, and she was also the chair of the preventative guidelines for women. And what she studied, and her ongoing study, was called the WISE study, an acronym for it was WISE, but it looked at symptoms that women have, either if they're going to have a heart attack or they have heart disease, and whether they were more or similar to men. And what she found, and is still ongoing, is that the typical elephant that comes on the chest, the pressure, the aching right in the center of the chest, is very rare. Maybe 20–25%.
In men?
In women.
In women, but more so in men.
More so in men.
Okay.
And the atypical that you would see, the typical things that women get that men do not get, are dizziness, nausea, tiredness, indigestion. These are the common things that they get.
That they don't even associate.
That they don't even associate.
Because
I have a lovely young lady that I've been taking care of for 8 or 9 years that was belching for 3 or 4 days.
Really?
And she just thought it was just gas. And she had a heart attack and had an artery that I fixed. And then even some years later, we had to send for bypass. And she's still doing wonderful. But the fact of the matter is that we use her as our poster child, so to speak, of how different the symptoms are. So that's our number one message, always, whenever we have Women's Heart Month, to really get across, to know your body, to know if there's any change from the norm. If there's any significant change, that here you are one day, and then the next day you have a new symptom that's just not going away. And you don't want to make it wait a day. You want to ask someone, is this normal? And you want to seek medical attention at that point, because a lot of times it turns out to be something rather catastrophic.
So do women say, I knew it just wasn't right? Is it that feeling that we get, because we all get these symptoms all the time, being dizzy, being tired? But is it do they say that? Is that a common thing?
A lot of times they say it's just not going away, or it's getting progressively worse. I'm sleeping all day. I had the flu. I felt like I had a flu, and I just didn't think it was anything more. And sometimes you make that phone call to maybe even your primary doctor, and it's not their fault because it's just an atypical symptom. So the bottom line is that if it's just getting progressively worse, or you just don't feel like it's right, call somebody, and or go to an emergency room, because the bottom line is that if you're in the middle of having a heart attack, sometimes just an EKG can help. Sometimes not, but sometimes blood tests can help. But the bottom line is that we're so attuned now. Most hospitals, they're so attuned to detecting early heart attacks. They have programs because the state requires them to really up the ante to get a diagnosis within 90 minutes. And really, we'd like to make it within 1 hour because your mortality is actually saved. It's improved from that standpoint the earlier we make that detection. So again, if you think you have a change and you have any of those symptoms that's listed at this point, we recommend that you seek medical attention, because look, it's better to be wrong. It's absolutely. If you have indigestion, good, let it be indigestion.
But you think in terms of going to a gastroenterologist instead of a heart. Well, but then if you do go to the wrong doctor, they should send you on to the right one.
What's the worst? Rule out the worst first. Okay, that's my motto of many, but that's one of them. It really matters. The worst thing that you do is that it's nothing to do with the heart, and you may have reflux. That's okay. The same nerves that go to the heart they also go to the esophagus and the stomach and the gallbladder and the chest wall, so that you can have any of those symptoms and still feel like you're having a heart attack. And that's in anybody. That's in anyone can have the same symptoms. But in women, and as we get older, in all human beings, but in women specifically, that's the whole premise of the hormone, heart, and anti-aging concept, if I can lead into that. Women have a unique concept. They have their own shield of protection, which is estrogen and progesterone. And one of the reasons why women have heart disease 10 years later than an average man of the same age is because of estrogen and progesterone. And somewhere, as an average between 48 and 50, those numbers start declining. Now, that 50 is an arbitrary number. They can decline at 42, so-called premature menopause. You can have surgery and have a hysterectomy way in your 30s. And a lot of women came up to me after this lecture last week and said, I had a hysterectomy at 32 and they wanted to put me on hormones, and they did, and then everything came out a couple of years ago, and then they took me off. Well, in fact, she was protected by being on those hormones. So if someone is on hormones out there and they're on more than 10 years, they're absolutely not going to have any heart problems whatsoever. And younger women between 50 and 59 have a much less risk of developing heart disease if they're on hormone replacement therapy or the now so-called bioidentical hormones that are out. We can touch a little bit on that if you
But
like.
are there some side effects from being on hormones, other side effects? I mean, it does help the heart, but what about other things?
Well, I think that, one of the reasons we go on hormone replacement therapy, and that's the catch-all phrase, is to treat symptoms. There are a lot of natural therapies that can treat symptoms. There are a lot of new therapies to treat osteoporosis, and there's much better ways to prevent heart disease. So we really don't necessarily recommend using hormone replacement therapy for all of those. Now, the bioidentical hormones are hormones that match your own hormones, but really, they're not natural. They're actually chemically synthesized from plant-based hormones. So they're made to identically simulate hormones. But if you think about it, if you have a risk of breast cancer or a risk of uterine cancer or a risk of heart disease, excess hormones tend to maybe cause those problems, as they did. So you have to be very, very careful. So again, going back to my first statement, know your risk. Know your family history. Know your own personal history. And a lot of times, it has nothing to do with just your total cholesterol. Your total levels of cholesterol can be relatively normal about 50% of the time. And we were discussing this before we went on about your friend who was 50 years old and female and had a heart attack. Perfect example of how there are newer tests that allow us to kind of detect what's going on in the body. And I break it down very simply and say that your body, when you have plaque, and for the most part, a large percentage of people will get plaque by about 40 years of age. Most people, that plaque stays that way till they're 90.
Okay.
A certain percentage, that plaque is going to grow like a snowball rolling down a mountain, and they get blockages that might cause those symptoms that we just talked about. And again, atypical in women. But a certain percentage of women will have that plaque that's more like a volcano ready to erupt. And it doesn't take much, a little 10, 20, 30%. That's actually, most of it is, 75% is going to be below 50%. So the blockage is not significant, and that plaque just kind of goes boom one night, most likely like it did in your friend.
Yeah.
And then again, the symptoms may be different in women. So I don't know what she had.
Not the heavy chest.
Exactly.
Yeah.
So case in point. So you have to know your risk. If you have a family history, I have a degree in lipidology as well as anti-aging, and we tend to kind of lump all of these things together in something we call proven total care. We try to use a little bit from every one of these methodologies, if you will, every one of these sciences, to kind of use testing and direct it to each individual person, instead of lumping everyone together by just guidelines. Guidelines are great. We always strive to at least get to those levels, but women can still have significant amounts of heart disease, such that by 60, heart disease is more of a killer than breast cancer. That's a common fact. And basically, women go this way and men go this way by an average age of 60, because of the loss of estrogen and progesterone, and then not being protected by knowing your own risks and treating and preventing those risks. That's the bottom line.